is that the trust of the people is no longer with this government. And despite the fact that you've considerably rolled back today in terms of the announcement that you made, if any of you people here in the House had been in that church today and listened to the elderly people, more than 2,000 of them, who were there, they are not at all satisfied with what has been announced, because they don't trust you anymore. Because they know that despite the fact that you have upped the limits to a certain extent, that with one stroke of a pen, once you take away the universal entitlement, that any minister could, with a stroke of a pen, bring down those limits, exclude more people, and they know even that the figures don't add up. And I mean, the minister here again tonight said that it's only going to affect 5% of the elderly. But frankly, Minister, it doesn't add up. My calculation is that the most you could save is about 20 million. I don't know where you're going to get the other 100 million from, but you're certainly not going to get it from the figures that are available to us at the moment. If now we're going to have 330,000 people entitled to full medical cards of over 70s, 20,000 excluded, that is not going to get you your savings. So people's concern is that you can come along and you can say at a later stage, well, we talked to the doctors, we didn't get what we wanted, and therefore, sorry, but we have to include more people. So there is no confidence out there that this is going to work for you. And it might work and save the backbenchers and keep the Fianna Fáil party together, and it might hold the Greens in government, despite the fact that I was on a radio programme yesterday with Deputy Gogarty, and he said that the scheme would have to be scrapped or the Greens wouldn't be happy. Now the scheme is not being scrapped. The concept of universalism is being taken away and is being removed. And similarly with the Fianna Fáil backbenchers. So you might have managed to hold them in despite what they said in the public airways, but you most certainly have not got the confidence and the trust of the Irish people. And I think you will see that tomorrow when that protest is held outside the Dáil. I am absolutely certain that that is going to be huge and that people are not going to accept it. And I mean, what we have here is a government that knows the price of everything and the value of nothing. And that is to be seen in what's happening to the health services in this budget. Now, the Minister has said that there's a 2.3% increase in the health budget. But, I mean, that is not even going to keep up with medical inflation. It's not going to keep up with rises in earnings that have already been agreed. And it's not going to keep up with the growing inflation and the growing population. So, I mean, there is absolutely no doubt but that the health services are going to be cut, they're going to be hit hard, and that is coming down the tracks for people. And the minute I do want to respond to Minister Harney in relation to what happened back when the universal entitlement was brought in by Minister Micheál Martin. The objection of the Labour Party at the time was to the fact that doctors were going to be paid 4 times more for certain over 70s than they were going to be paid for other over 70s, and that was going to provide an inequality of reward to doctors. It was going to affect the way in which the population would be served.
Are you taking 10 minutes?
10 minutes, yeah.
Yeah, you have 1 minute left. Then.
Only 1 minute, right. Well, I just want to make it clear that that was the problem that the Labour Party had with this at the time. I also want to make it clear that the Labour Party proposed an amendment to the Competition Act which could have been taken on board by the government, which could have allowed you to talk to the doctors. And I don't understand why 7 years later it's only now that you're going to the doctors and you're asking them for a new deal. That could have been done over the space of the last 7 years. And Minister, I just want to conclude by saying that there was... I think you have 5 minutes. Sorry, I've 10 minutes.
10 minutes in the slot. Sorry, I miscalled that. My clock says there's 20 minutes left in this slot, but there's obviously more.
Even Homer nods.
So sorry, I was wondering.
Haven't you? Yeah.
Sorry, Lashkan Corla. So
there's 20 minutes left before the conclusion of the debate, and that was on my clock.
Right.
So yourself, you take up to 20 past and then 10 minutes for Deputy O'Sullivan. Is that what you want to do?
So I have how many more minutes?
As I said, there's 20 minutes left in this slot, so you divide it as you like.
Okay, so I can go to 20 past?
Yeah.
Okay.
Not you personally.
Yeah.
No, I'm sharing Cueve Internet. Yeah. Okay, thank you, Lashkan Corla. I'm sharing with Deputy O'Sullivan.
Yeah, I called Deputy O'Sullivan at 20 past.
Okay, not tonight.
We work out the list.
Okay, Lashkan Corla. Well, I suppose one of the main points that I want to make in relation to this is that over the period when the over 70s have had their free access to medical cards. There is scientific evidence in studies that their health has improved. And it's in that context that I say that the government knows the price of everything and the value of nothing. Because what has actually happened during the period when this universal entitlement was there is that because the elderly were able to go to their GP, they were able to have flu vaccines, they were able to have their blood pressure checked, they were able to, the actual outcomes were that there were less people over 70 who were described as disabled in the period when they had the free access than in the period before that. So there is real scientific evidence in a study that was printed in the Irish Medical Journal that there was actually an improvement in health during that period of time of the over 70s. So the point I'm making is that in taking this away, you're actually making a retrograde step. And in accordance with the policies that you, Minister, have enunciated yourself, that you want more people to be cared in the community, you want to keep people out of hospitals, you want people to attend primary care. In taking away the entitlement to a free medical card for over 70s, you're actually taking away the kind of services that were keeping elderly people out of hospital. The other aspect of that is that if you don't have a medical card, you not only don't have access to a GP, and to your medicines, but you also don't have access to things like a public health nurse, like a physiotherapist, and the other supports that are absolutely vital to keeping elderly people in their own homes. So in actual fact, you are saying that you want to keep people in their own homes, in the community. But one of the direct results of taking away a medical card from over 70s is that more and more of them will actually be going into hospital, into much more costly kinds of services, which are not good for the community and not good for the elderly person concerned, and not good for your budgets either, Minister. So I think we should learn from what has happened in those 7 years. And the other aspect of taking something from people who have had it is that you take away the certainty that they have learnt to rely on over the years. And one of the things that we thought might be happening today, when we first heard that there was going to be a U-turn, was that we thought that you might leave the card to the over 70s who had it already, but that is actually not the case now. And I think there's a particular dishonesty in suggesting and implying, and I heard a Fianna Fáil backbencher on the radio today implying that, well, there'd be a blind eye turned more or less if you held on to the card, even if your income was over the limit. And, you know, elderly people, if whatever else they are, they're honest. And they're not, I think people were horrified at the idea that they might hold on to the card if they actually didn't qualify. So, you know, there is an element of uncertainty that has been introduced into this, which is a serious problem for elderly people. Fianna Fáil once upon a time said that health cuts hurt the old, the sick and the disabled. That is exactly what the government has done to the old, the sick and the disabled in this government. And I know from listening to people that they will not forget that.